Thank you. So as Kate said, I'm Andrea and I work within the improvement science theme at Yorkshire Humber ARC and work closely with Professor Rebecca Lawton, who heads up the theme, and my colleagues Lynn McVeigh and Emma Ayres, who are researchers in the team. Just do a quick intro to Will as well, if you want to just say hi, Will.
Hello, I'm Will. I'm an acute medicine doctor at York, and I've been doing a part-time PhD since about 2018 in the PSRC.
Super chuffed that Will was able to join me for the lunch and learn today, given Will's clinician by background, but also obviously research active in doing his PhD, and therefore I will cover the project itself and the ins and outs, but Will give some sort of personal reflections on his experience of working in both camps, as it were. So really, before getting into the granular of search terms, which I probably won't go too depth into anyway, it's just actually, why is this important, and why did we do this piece of work, and actually why are you guys here to hear about it, because it is important. I've done sort of three quite simple drivers here, and there is evidence, research evidence that more research active organisations, whether that's puddles of clinicians within organisations doing research or an organisation as a whole, there's associations there with positive patient outcomes and some involvement in, for example, trials linked to generally overall lower patient mortality, for example, within the broader setting, but also a larger weight of evidence around more research active organisations are associated with kind of more positive processes of care. So, examples of evidence-based practice and keeping up to date with national guidance and adoption of evidence-based practice and that side of things. So there's a decent amount of evidence for that, but maybe less evidence of the benefits for the actual staff themselves. So there's benefits for the organisations and there's benefits for the patients, but there's not so much evidence other than kind of predominantly hearsay and conjecture about staff themselves. Obviously, in the aftermath, but during COVID, in the aftermath of COVID and still now, the NHS is still in somewhat of a crisis mode, and with strikes and staff shortages and demands for care, it calls on more, and unfortunately in a way, calls on more innovation and people working in new ways, and we're seeing more not only active attempts to fill the gaps in staffing, but also broaden people's roles and people to try and be more innovative, and therefore developing skills in different ways. For example, through research skills could be another driver for why it's important to get staff involved in research. And then finally, in terms of retention and wellbeing, there's some evidence to suggest that there might be some positive benefits of research involvement around job satisfaction, and there's that kind of ... that might lead to better retention, and also some evidence of an organisation that we maybe get less staff turnover. So these are sort of main drivers, and as a result of that, we can see there's been quite a lot of NIHR funding pumped into this area, and fellowship schemes developed, and quite a lot of focus more recently on social care staff. And different types of roles developing, like advanced clinical practice roles and frameworks governing that side of things. I think Will just wanted to give us a bit of his own reflections on this as well.
Thanks, Andrea. Can you hear me all right?
Yeah.
Yeah. Actually, I was just thinking, I was in a meeting earlier and thinking about that well-being and retention thing. So I was talking about the fact that having become research active, that I felt my well-being in work was better. But we were reflecting on rejections and harsh ethics reviews and journal rejections and things. So one area where research introduces another area of challenge, I guess. But it's a complex slide, this, but it was just really, I think the idea was to give a brief personal perspective of being someone who's, a healthcare staff involved in research. So at the beginning, I have a lot of support from my NHS trust where I work, York, and then obviously the NIHR ARC and PSRC and YQSR in setting up a part-time PhD so that I could do, develop research skills alongside clinical work. And obviously there's been lots of personal benefits to that in terms of, I think, you know, lifestyle perspective, and you know, it suits me well, that sort of lifestyle. So it certainly improved my, I think, my life balance. But professionally, I guess, having developed these sort of, or continue to develop skills and knowledge around research methods and ethics and funding applications, it's sort of broadened my perspectives. And some of that's research perspectives, but also some of it's just about other perspectives clinically. So certainly some of those research experiences have transferred across into my clinical practice and how I view that. And then loads of fascinating connections, which again have broadened my perspectives. You know, so meeting people I wouldn't have met otherwise, whether they're clinicians or researchers from other parts of the country, but also other countries, and getting to work with other people has been really, really interesting and provided lots of opportunities. So alongside my PhD, I'm very lucky to have got involved in lots of other projects. So those are on the far right. So things like Reboot Med, which is a project around looking at resilience for doctors, looking at cognitive behavioural therapy-based intervention for doctors to prepare them for stress at work and things. Doing some research around simulation, mannequin simulation in medical education, and some other projects. So I think, and I don't know who's on the call, I guess, but it might be this is well known to this group, I guess. But certainly from a personal perspective and other people that I know, I think supporting healthcare staff, if they want to, obviously, engage in research is a really, has a huge amount of benefits for the individual, the organisation as a whole. And I think we'll come back to, I guess, one of the things that I think about a lot of this, some of the challenges to that. And I think, let's be honest, I guess as a doctor, I'm privileged in that sense, aren't I? Because there's been a well-established pathways and support for doctors getting involved in research. I think really it seems that the effort now needs to put into other groups within NHS and social care, which is happening, isn't it? Obviously. I'll pass back to Andrew.
Okay, thank you, Will. So, and in some ways, Will's picked up on quite a few of the main findings from our review, so I'll probably be able to link back to some of the stuff Will's touched upon when we get to the results slide, as it were. So, but in short, and I won't go too in depth on this because it's the joy part of the talk, but it's a scoping review, and thus the search strategies developed across multiple databases. But there was also a smaller sort of grey literature element to the search as well. And the key really was the search was structured around applied health research. That was the topic rather than clinical research, for example, and the benefits for staff themselves rather than, so if an article, for example, talked just about the benefits for the organisation or the patients, it wouldn't get carried forward into the review. And we're interested in health and social care professionals. And this was quite a broad part of the search strategy. So all different types of allied healthcare professionals are fed into terms are fed into the search. And ultimately we're interested in the different types of involvement. So that could be anything from participating in a research interview, for example, through to clinical academic roles, which are much more intense and involved experiences or exposures to research. We're then interested in distilling what the benefits were from the staff perspective, and then seeing if there's any sort of interaction there between the types of benefits experience and the type or the sort of level or intensity of involvement. As with all sort of reviews, obviously it largely centres upon extracting certain types of variables that you've agreed in advance, putting it all into an Excel spreadsheet, and then doing your pivot tables and seeing where the associations are between benefits and types and so on. But what's really important with the nature of this being what are the benefits for staff themselves, to actually do a workshop. So we arranged a workshop with 4 research active clinicians, and Will was indeed one of those clinicians involved in the workshop. We also had Dr. Angela Grange, who's within the Yorkshire Quality Research Group, and two other colleagues, Jane Maran and Jane Schofield, who also research active clinicians, were also involved in some of the data extraction, but also this workshop where there was distilling of the benefits. And in effect, what it amounted to was a lot of it, we focused on free text data to start with. So all of the benefits extracts were summarized free text within the Excel sheet, for example. And then those were then shared at the workshop, and people were asked to try and group them into themes and arrive at a consensus. And those distilled benefits, those distilled themes of benefits, were then coded onto the free text extracts within the big Excel file. And then finally, obviously, as with all scope reviews, did a synthesis and recommendations, which we'll obviously at the end. Just to come back to who we is, it's not just me. So this work is a product of discussions at what we call, called the Crystal Network, which is a cross-ARC improvement and implementation science theme leads network. Bit of a mouthful there. And this is basically a network that Yorkshire Humber ARC set up, and it's working with other theme leads that have expertise in improvement and implementation sites across the wider ARC. And so there's 5 ARC theme leads within this network. For example, obviously Rebecca Lawton at our ARC, there's also Natalie Armstrong at Leicester, Paul Wilson over at Manchester, for example. And we also got representation from this institute and our colleagues over at the Improvement Academy. So it was a consensus that this is an important area, something we wanted to work on it as a group together. Obviously got our research active clinicians, so Will on this call, Angela and the 2 Janes that I've mentioned, who did the distilling of the themes. And we also took advice from what's called the ACON group. This is a Yorkshire Humber ARC set-up group addressing capacity in organisations to do research. And that's representatives from organisations that are interested in developing their research profile and their research cultures. And we took advice from them in terms of nailing the search terms, things like that. And just to flag really, and being really upfront here, that whilst I'm doing the presentation today with Will, the upfront work on this project was led by a couple of colleagues who have since left, and hence why I stepped in and I've got it over the finish line. So originally a colleague called Emily Park, who was finishing off her doctorate and has since gone down to the bright lights of London. She did a lot of the original extraction and leading of the research, and she was also supported by another colleague, Laurie Cave, who now works at the University of Leeds. So I've definitely stepped in towards the end of this project, but will obviously do my best to answer any questions at the end. So in terms of the sources, we're almost getting to the results section here. We using those quite broad search categories, we identified 49 what are called records, and these were a nice mix, basically sums it up. So these were from the published databases and the grey literature, and quite, for 49 records, was a good mix of different types of source. So predominantly journal articles, but there were some blogs in there, a couple of opinion pieces where someone was reflecting on their experience of being a research active clinician, for example. Quite a spread across the geography. I think there was maybe one that was based in, for example, in Northern Ireland, some that had multiple sites, and national surveys are in there. So it wasn't all concentrated in London, for example. Nice range of health professionals were the focus of the studies or the blogs and so forth that we read. Definitely not dominated by doctors. I think, off my memory, I think there was maybe only about 4 that were purely focused on doctors, and the rest were a mix of predominantly nurses, actually, nurses and midwives and other allied health professionals as well. So as you can see here, there's of the 49 records, the majority were journal articles, but like I said, there were others in there. The biggest categorisation of professions was actually mixed. So you'd have a study where it was nurses and midwives, nurses and doctors, for example. And we had a nice mix of different types of involvements. Again, when you're doing these sorts of reviews, you don't want it to be all clinical academics and all medics, or all in London and all just involving brief exposure to research. You want that nice range to pull out, really. And there was that. So the biggest category in terms of types of involvement was clinical academics, which we see as a more intense end of the spectrum. But there were definitely some records in there where people had just taken part in an interview or done some data collection, for example. And there was quite a nice split of what I deem sort of centrally funded, sort of big, like a fellowship program funded by Help Education England or the NIHR, versus non-centrally funded initiatives where, for example, an NHS trust has maybe found a small pot of money within their budgets, but it's definitely born and bred within that trust and has not had this big, NIHR backing to it, for example. And this is in effect the main results slide. And so in effect, there are 6 benefits that we distilled at this workshop of our research active and clinician colleagues. And it's really nice to see actually the one that cropped up the most across the range of records was this one about personal and professional fulfillment. And that was exactly the sort of examples that Will was giving us at the start of the session. So, and there was some really lovely sort of adjectives coming up there. People talk about research was exciting, for examples how research had been transformative. And there's one example where someone had said they'd taken back their notice, had gone to quit and they'd taken it back, so enjoyed the exposure to research, so they realised, oh, maybe this could be more for me. And examples maybe is more along what you'd expect around professional fulfilment. So people had it carved out more career opportunities for them, and examples of people talk about how, like Will was saying, in fact, they felt like they maybe got a bit more work-life balance, gave people a bit of headspace from the pressures of clinical practice. So lots of really nice examples coming out of those sort of projects. Where people talked about improvements to practice at a local or national level. In some ways you might think, oh, that's a benefit for the staff themselves, but the way it was spoken about came across very much like that. So that sense of pride and achievement had developed, they'd had some impact on a local policy, developed a palliative end of life care strategy, for example, and it was beyond it just being a benefit for the organisation. It was a personal fulfilment that people were talking about and how that made them feel about where they worked, and lots of opportunities of building of connections and networks. Again, something Will talked about earlier, that people within this country and beyond, and that often quite positive, that spoke very positively about in a lot of the records about being with like-minded people. We've got this common goal, even though you might be from a different profession, we're all interested in whatever the research topic was. Opportunities for learning is a more obvious one. You'd hope if people had had exposure to research that they might develop some research skills, and obviously that is coming out of a lot of the records, and people talk about data collection skills and so on. The gaining of general skills and competencies. I think this almost links to that idea of that workforce transformation and enabling people to develop new skills and be innovative and things like that. And there are examples of people talk about project management skills, time management, that had some experience of mentoring and supervision, which I found so to develop their skill mix more, and how that might then feed into more professional development opportunities and so on. And then finally, this idea of using evidence more effectively. So getting into that idea of the study by Bose et al. 2015, you're talking about improved processes of care, people using evidence more effectively to create change, and people feel more confident doing that as well. So that's where it became more personal again, that we're more committed to improvement and had the confidence to look at research evidence to inform their decision making. When we did that comparison of these 6 different benefits and comparing across levels of involvement, obviously in the ideal world, there'd be so many sources that I could do that on a really granular level and say, well, this research, just taking part in an interview is associated with XYZ benefits, and just doing this was associated with these benefits. And but unfortunately, obviously with 49 records, we were a bit limited. And so we had to do it in a slightly cruder way, where we had to compare clinical academics, which we agreed would be the most intensive form of or type of involvement, with the others as one group, basically. So obviously with that caveat in mind, the good news is that all levels of involvement, all types of involvement seem to have some benefits. And at the lower levels, by lower levels, I mean, you know, taking part in a research interview or, I don't know, attending maybe a relatively short research training session, for example. People tended to still talk about some benefits, and they tended to be ones like opportunities for learning, so they picked up some basic research skills, and personal or professional fulfillment. And to give a couple of examples of that, these are a couple of kind of extracts, I wouldn't call them quotes because obviously this is a spoken review here, but so staff felt supported and engaged in the opportunity to have training about and discuss difficult situations. And that to me kind of reminds me of predating the Crystal Network, the Cross Art Network, discussing this as a topic to do. Rebecca Lawton, who heads up the improvement science team here at Yorkshire Humber ARC, had said she'd, you know, there'd been some insights and some studies they were doing around the second victim literature, you know, where there's an adverse error at work, something goes wrong in patient care, and how our staff supported. And doing some interviews in that area a few years ago, some of the staff had said how helpful it'd been to have that little bit of opportunity to take a step back and reflect on what happened, and in a non-judgmental way, and it'd been a cathartic experience for them, and that being the beginning of the seeds of why this might be an important area to do further research on. And here and again, there was a couple of examples here, like where someone had evidently taken part in some sort of workshop and had said about it really brought alive the patient perspective, and hearing that in a way that they haven't had exposure to before. It'd been this really good learning experience for them. So it's that really nice fact that even sometimes quite low levels involvement can still have some benefits. It doesn't necessarily have to be the full-on, you know, funded experiences. Where there were differences tended to be the clinical academic records talk about clinical academics compared with maybe the lower levels involvement. Tended to talk about more opportunities for building connections and networking compared, you know, like that's more associated with clinical academics. But alternatively, we also found the opportunities for learning, particularly research skills, were more examples of that cited in maybe some of the less intense types of involvement compared with clinical academics. So there were a couple of differences there that came out. Across the other benefits seem to be pretty evenly reported, but there were a couple of differences we did spot. Obviously, we're talking all about the benefits here, but Will just wanted to bring a bit of a rose-tinted telescope to the topic. I'll just hand over to you, Will.
Yeah, without being too much of a pessimist, I guess this all sounds very positive, doesn't it? When Andrew and I were talking about it, it sounds great, and you know the benefits seem really clear. But I guess there's the reality, isn't there, of I guess why are there not more clinical academics and people with splits in their time, and why do some people have to make the choice between being a clinician or being an academic? And I think historically, you know, medicine has allowed an opportunity, or doctors have had an opportunity to split that and carry on with clinical work, whereas I think other professions and other staff groups haven't. So I guess it was just that while it wasn't the sort of aim of this piece of work, was it, Andrew, to look at specifically the barriers and things. There is some information there about that, and you know, it's probably another area to look at. But it was just, yes, to temper, I guess, with you know, as Andrew said at the beginning, the challenge we currently have with workforce retention. You know, there's obvious barriers that everyone in here probably think about in terms of providing more opportunities for clinical academics. And in fact, I was in a meeting earlier where there was an obstetric doctor who had received an NIHR fellowship. So, you know, great opportunity, centrally funded opportunity to do research, but the deanery, the training authorities essentially almost said you can't go and do it because you're that close to being a consultant, and we need consultants essentially. I think she's had a battle and she's got there now, but there's all sorts of barriers, I guess. So I guess that will be another thing, is to think about how do we make it easier. And while there are formal pathways like now NIHR funded pathways and things, you know, it's how do we make opportunity more broadly available, I guess. And I think Andrew was going to come on to part of the next steps, and part of what's been happening locally is about trying to develop some more homegrown local opportunities for involvement in research. But I'll hand back to Andrew.
Okay, thank you, Will. So yeah, and actually before planning this session, Will and I, so we're definitely we're definitely here to quite happily take feedback and suggestions. We're not talking here as, you know, self-professed experts on the topic, you know, that it's very much been quite a lot of people involved in this, and we're definitely open to people's suggestions and recommendations, and the ballpark's open for, you know, what we do next as well, of course. So so our next steps in brief, a publication is in fact drafted, and I'm just waiting for various people to sign off on it, and then that will get submitted for review. The cross-ARC route, where this idea was originally born and agreed to go forward as a sort of collaborative effort, a meeting, I believe, next month. So we're going to obviously have a chat and see if there's anything falling out of this that might be good to do follow-on work with. So obviously scope and reviews are quite high level, and there's definitely been quite a lot of Excel file and pivot tables and things that I've done. And actually, obviously, that's not the full richness of the experiences, so there might be potential for us to do some more in-depth work, and people might have suggestions today, for example. And it was just really to flag it, obviously, at the Yorkshire Humber Patient Safety Research Centre. Unfortunately, it's now just closed a few weeks ago, but they have developed a patient safety research development award, and that's an opportunity for budding clinicians to get a bit of protected time to have some, you know, exposure and via a short placement to research in the area of patient safety. I'm not sure whether we're doing that on a rolling basis, but almost follow the Yorkshire Humber PSRC and watch the space. But the applications are currently being reviewed at the moment. And just to flag in a sort of a shameful plea, but again, if we've got any clinicians, for example, on the call, or you know of any clinicians who are interested in research, obviously we have our improvement science snapshot series, which give people brief opportunities to learn with a cup of coffee, you know, different improvement science methods and research considerations, and a range of Yorkshire Quality Safety Research Group training resources. But on that note, I will finish there, and I think we'll be happy to take any questions. Thank you.
That's lovely. Thank you, Andrea, and thank you, Will. That was great. Has anyone got any questions? Feel free to type them in the chat if you don't want to put your hand up. Otherwise, if you put your hand up and if you can't find the hand, just wave at us, because a lot of people sometimes can't actually find the hand on Zoom anymore. So an actual physical hand is completely fine as well. You must have covered everything, Andrea.
Fine by me. If people think of anything afterwards as well, you know, if you can, I'm sure you can find. So I didn't put my email address on there, but I can be found. Happy to take suggestions on email as well for ideas.
Oh, we've got a question in the chat, which was, it said, Narinda said it would be interesting to know what staff benefits came out of the COVID period. Is that in terms of research, Narinda? People getting involved in research in COVID, or just COVID in general?
Maybe typing.
Yeah.
I don't. When I inherited the project, like I say, it was led by a couple of colleagues before they left in terms of research.
Yeah.
Led by a couple of colleagues, and they left. And when I inherited the spreadsheet, there was loads and loads of variables in it. It was a very, very busy spreadsheet, and there's probably certain variables that I haven't actually looked at because they were beyond the scope of what I was asked to do, and so on. I can revisit. I don't recall it being a COVID one, unfortunately. So I do recall a couple of papers mentioning COVID, but I wouldn't have enough knowledge of. I'd have to revisit them almost, unfortunately, to answer the question.
Narinda's put that they did some interviews of staff lived experiences, and there was an interesting range of experiences despite the challenges during COVID. I think it was quite challenging. I think it was quite challenging for research staff. I was research delivery during COVID, and obviously all my normal studies stopped and we all concentrated on COVID studies. But I think in a way, for us in my area of research, COVID actually got more people interested in research because they actually really wanted to help. It was a thing that they could really kind of decide, see that needed sorting. So when we asked for volunteers and when we asked for staff to help refer people, it really did get more, especially more clinical staff involved in research and involved in the process of it, definitely.
Yeah, I know within the Yorkshire Quality and Safety Research Group, we did the redeployment study, which was interviews with clinicians and their experience of being redeployed, so moved from one area of care to another, and how that process was handled and areas for improvement. And again, that exposed certain people to research who maybe wouldn't have had the opportunity before. And I believe that study was one of the ones where people got the positive comments about having that bit of a cathartic experience at a lower level of research involvement, just to become aware of research, and like you say, in a way maybe they haven't before.
Yeah, absolutely. Has anyone got any other questions? Oh, that's lovely. Well, what we'll do is this recording will go on our YouTube channel. So if you've got any colleagues that haven't been able to make it today, or you want to just watch it again for any of the references, it will be on our YouTube channel by the end of the week. We also have a newsletter, and I've put the link for the newsletter in the chat, if you want to sign up for that as well. So please do share it. And if you want to get in touch with Andrea, you'll have the email address that you got the invite from, which is the Yorkshire Humber ARC at BTHFT email address. And if you email that, we can channel that through to Andrea or Will.